pleasure to welcome you to this educational DVD, which focuses on some of the key elements of managing older people with diabetes. It's been produced by the Institute of Diabetes for Older People, based in Bedfordshire, and the Older People's Steering Group for Diabetes, which is a national group established by NHS Diabetes at the Department of Health. It's not possible, of course, to cover every important aspect of diabetes in older people in one DVD, but we hope you'll find that we have included interesting and informative contributions from experts in the field. We hope you will consider using this DVD individually as an educational tool or as a presentation to a group of health or social care professionals involved in diabetes care. The prevalence of diabetes in the United Kingdom population is about 4% overall. But as we look at people above the age of 65, the prevalence of diabetes increases and approaches nearly 10%. This phenomenon is also found in other parts of the world. Let's look at some data here from the United States. We see data taken from a cross-sectional survey of non-institutionalized people in the United States. This study is called the NHANES data. It's a very well-known, well-established epidemiological study in the United States. And here on the right-hand side of the slide we see the prevalence data. And what you see here is that in all age cohorts above the age of 45 we see quite a high prevalence of diabetes in the population, approaching nearly 18% in the age group between 65 and 70 years. But please notice the dark blue columns also in this diagram. These relate to the prevalence of undiagnosed diabetes, and this is very high. And this pattern is replicated to an extent in our UK population, with large numbers of patients out there in the community with diabetes that has not been clinically diagnosed yet, and perhaps having symptoms of diabetes and possibly early complications. Moving on, we show in this slide some bullet points relating to diabetes care within care homes in Birmingham as a representative part of the United Kingdom. We see here the statement that there is little evidence of structured diabetes care, no specialist follow-up, and that diabetes is known to be an independent risk factor for admission into a care home. We carried out glucose tolerance testing in a large number of care home residents in care homes in Birmingham, and these were our findings. When we went round to the care homes and noted all those that had a diagnosis of diabetes in their case records, the prevalence was about 12%. But when we carried out oral glucose tolerance testing on the other residents within the care homes, we found that the total prevalence of diabetes after testing actually approached 27%. So roughly 1 in 4 care home residents had diabetes, irrespective of whether they were living in a care home of a residential type or of a nursing home type. Here we see some information relating to the burden of type 2 diabetes in an aging population. We see that type 2 diabetes in older people results in a twofold increase in the rates of myocardial infarction and stroke. We see that the onset of heart failure in older subjects with diabetes drops dramatically from a 5-year rate of 85% to 21% when heart failure is diagnosed. And another interesting fact relating in part to a health inequality issue, and that is in the United Kingdom the median age of patients starting dialysis is 65 years, and 25% of dialysis patients are aged actually over 75 years. But only 14% of those who receive a kidney transplant are actually aged over 65. Here we also see some evidence of the impact of depression in a population of people with diabetes. So let's look to the right of the slide in the upper panel, and we see data relating to people without diabetes. And we see two curves. These are survival curves. And what we note here is that in patients whose CESD score is above 16, that there is a decreased survival. The CESD score is a measure of mood, and when it is high, it means mood is very low, and the patient possibly may have depression. In the lower panel, these are data from people with diabetes. These data taken from the NHANES study show that the separation of these curves is much more enhanced. In other words, the survival is much less. So that when older people with diabetes become depressed, their survival becomes worse.